Welcome back, friends. You know, hearing is so important. That's why it's also important to be on the lookout for those developmental milestones. And for our last conversation about this series, we're talking about that. Guess who's here to talk about it? I'll give you one guess. You are correct. It is Kyra Coleman. She is a speech pathologist with Manning Family Children's. You know, what's so interesting about this one, I love how you say at the end of the day, hearing is the very foundation to how children learn to communicate. So it's important that we look about this.
Yes, hearing is so important. It is the first sense that we develop in the womb. So it's so important that we are looking at birth to see if children are showing any concerns for hearing loss or anything like that.
It's so true, because when trying to figure out how to say words, how to recognize words, they need to be able to hear them. So when it comes to some of those milestones that parents need to be on the lookout for, what are they?
Yeah, so like I said, they start at birth. So at birth, you want our babies to start startling at loud noises. We want them to start blinking or having some sort of a reaction to a noise, and that'll be like even a dog barking. You know, you want them to kind of shudder and be like, what is that? Yeah, you want them to show that reaction that they're hearing their environment. And so at that age range, they're also learning their new environment too. And then we'll jump to about 3 to 6 months. So then in this range, you want them to start turning their head to different sounds, whether it's on their right side or on their left side. We want them to start identifying sounds, figuring out distinct sounds, what those sounds mean, and things like that.
It's so important. And you know what's interesting as well? When it comes to hearing, right? We were talking during the commercial break.
Yeah.
A lot of times, a newborn may fail their first hearing test, and the parents don't follow up.
Yes. So it happens like really more common than you think. A lot of babies will fail their initial hearing screening, and it's so important to go and get a follow-up if they do end up failing their hearing test, just to make sure. Because like we said, it's so, like, hearing deficits can be so subtle. So especially in our infants, if they had a failed hearing screening, go as soon as you can, get that off your back, just be like, okay, I just want to go make sure.
And I feel like it's like a domino effect as well. If they maybe have a hearing developmental milestone delay, then that's going to lead to maybe a speech one as well.
Correct.
Because again, they can't hear how those words are supposed to be pronounced.
Correct.
And when it comes to warning signs, right, what parents need to be on the lookout for? If they don't startle when they hear the dog barking, is that also a sign as well?
Yeah, it could be a sign. You know, we always look at these signs, and if we have those concerns, and we're just going to like advocate for your babies. It's so important. You know, if you just have a little kind of twinge of doubt in your head, I'd definitely use that sign, and you would go forward with that and contact your pediatrician and just say, hey, I have a concern. You know, she's just born, but I just want to make sure. And nobody's going to ever question a parent for that.
And what's interesting to note as well, beautiful people, a hearing developmental milestone delay could be subtle. It can also be temporary as well. Let's talk a little bit more about that.
Yes, so they can be really subtle, especially if it's just a mild delay and they're just learning, and babies are just learning to speak. Sometimes it can kind of look like how other babies are speaking if they're not saying those initial consonants, like if they're saying at for cat, or if they're saying uppy for puppy. You know, you could say, well, that sounds like another 2-year-old, you know, or 1-year-old who's also saying those things. So it can be so subtle. So, and also, like you said, it can be temporary. Sometimes it could just be a fix if they need to go to an ENT and look into things like drainage of the ears. If they have a lot of fluid in their ears, irritation often, they're getting ear infections often. It could be an intervention like that that's needed. So, you know, you never know. It could be a temporary fix. It could be long-term. That's why it's so important to go get that intervention as soon as you can.
Absolutely. And it can be sometimes in only one ear, right?
Correct.
So it's important to note that as well. And that's why you have to go and make sure you be on the lookout for all of these different milestones. When it comes to treatment, right, you're going to see a pediatrician, then an audiologist, right? How do they help?
Yeah, so a pediatrician will start with doing their own hearing screenings for the most part, and they'll also kind of look into your ears. You know, as a little child, you had the little thing that they used to look into your ears.
Yes, we taking it back.
Yeah. So they'll look for, you know, irritation, redness, things like that. And then if they also have concerns, then they'll push it forward to a pediatric audiologist who specializes in these hearing tests for our children.
It's so important. And again, everybody, when it comes to those milestones, birth to 3 months, 4 to 6 months, 7 to 12 months, and 1 to 2 years are all milestones you need to be on the lookout for. But I'm so curious, Kyra, you know, we've been talking about all these different milestones to check, right? Say there's a parent watching this right now who are like, oh my goodness, I did not know this until watching Great Day Louisiana today. Now they know, but they have now an 8-year-old child, a 9-year-old child, and they may have some of these developmental delays. How can they help in the latter age, right? Now that they're past 4 and 5?
Yeah, it's important to just follow those same guidelines. I would call your pediatrician and voice your concerns and say, hey, I saw this and I remember, a few years back that he did have these concerns, but I didn't address them now. But I mean, now it's time to address them. And I would communicate that to them, and they'll push it forward to an audiologist or ENT, and then they will address those concerns.
Because what age do y'all work up to?
We work up to 21. So we work across the lifespan, from birth to 21 years old. So I'm about to say, 8 years old, 10, 12, 13, 14, at any age. It is so important to get that intervention for speech and language and hearing.
Absolutely. Just be on the lookout for this, beautiful people. And again, share this information with someone you know with younger kids, because we all want them to hear, we all want them to speak, and we all want them to understand language. Kyra, thank you so much for being here, sister. You got comfortable on that couch, as you should, because you've been here for a while. Thank you so much again. And look, everybody, for more information about anything we talked about when it comes to developmental milestones, log on to manningchildrens.org. They have a lot of great resources there.